So I put this picture up here. Have you guys played with ChatGPT?
Yeah.
Anybody?
I had to write a resume for it.
Yeah? I use it all the time now. But I had it make this picture, and I was like, my wife's leaving us. I had it make this picture on choosing a direction to go. But it was funny because it put left, right is forward, and straight is to the right. I'm not totally sold on ChatGPT's pictures yet. But that kind of makes sense, though, when we're thinking about scoliosis, because it's confusing which direction to go. I mean, should you do surgery, or have you exhausted conservative treatment? Should you do this method or that method? Or, I had a kid go to somebody that was using some electrical stimulation, saying that this was going to cure their scoliosis. I mean, how do you decide what to do? And so my biggest thing is looking at, what are your goals? What's most important to you? Are you looking to limit the progression? Are you looking for less pain? Are you looking to improve the look of it? Are you looking to avoid surgery? Are you looking to stop progression of it? I think we have to look at what your goals are, and then we can fit the treatment into that. We also have to think, what's your Cobb angle? If you have a 12-degree curve, treatment should look different than if you have a 65-degree curve. So we have to take all those things into account. We have to think about the growth potential. I mean, a lot of us in this room have no more growth potential, except for negative growth potential, right? Is there a lot of growth left? In a 6-year-old, there's a lot of growth left. So that determining what to do with that might be different than if there's no growth. Is it progressive? Has it progressed already? And is there pain or neurological compromise? If anyone in this room is having like weakness in a leg or significant numbness and functional loss because of a pinched nerve in the back, then we think more about surgical intervention. If we're not having pain, then that changes our thinking. So as we get into questions, I want to kind of field questions where you are and see if we can help decide where to go with treatment. I mean, some of you I've seen in the clinic before, or my other therapists have. Some of you I haven't. And really, Scoliosis 101, in my opinion, is determining what to do next. And I like to be a resource for you. So, and I think, and just going along that, for those who haven't done these exercises, it's not something you have to go to the gym necessarily for. We try and make it doable at home, but really, what I'm really noticing this past year is like, okay, we need to find the ones that are most beneficial. Some people, yeah, give them 15 and they're going to do that for the rest of their life. Fantastic. But most of us, me included, it's like, I just want to know the top 3 that I should be doing, and then go to town. I've had multiple patients who I've seen in the past that I've seen back for a refresher, to be like, okay, let's see how you're doing with the exercises we've done before. Let's progress them and figure out those 3 or 4, and then send you on your way to do those and then follow up. So if any of you who have done it in the past, maybe it's worth us getting together and really just reviewing, having some accountability, like, okay, these are the 3. And because really, if we look at the other options, I mean, surgery is a big option. Surgery is not where we want to go. Bracing for some of you isn't appropriate or available. And so what are we left with? We're left with either waiting to see if it gets worse or doing something about it. And I think that's the key, is rather than wait and see, which is how a lot of surgeons like to look at the spine. Oh, let's wait until it's bad enough for us to do surgery. Or in adolescence, let's see if it progresses on the next x-ray. Well, isn't there something that we can do in between there? And there is. We just need to make sure it's the most effective thing for you. So
For the exercises, is it pretty much a lifetime? You're doing the rest of your life?
I would say they are for you as long as you still have scoliosis.
You need to go back to the old adage, if you don't use it, you lose it.
It's true.
And it's
It's
true. You
true.
don't keep moving.
Which,
I've seen that firsthand with my husband.
yeah, which kind of sucks, right? Where you see your neighbor who has a knee replacement, and they have rehab for 4 to 6 months. And they're doing great, and they don't have to think about their knee much anymore. Unfortunately, we can't replace the spine, and we can't. You're always going to have scoliosis, and that, I mean, that sucks. But at the same time, there are things you can do about it. So it's just finding the right things, committing to doing them, and then sometimes it's about having a little accountability so that with someone, it doesn't have to be with me, but someone to be like, hold me accountable in doing these. But I think the bigger thing is the things that you're doing you should be feeling like they're helping. If you're not feeling like they're helping, we need to figure out which ones are most helpful, because that's the most motivating, is when something is helpful, right?
First, because he's going to do this and that and the other, and then I'll be more informed about what exercises to do. Or
X-ray is all we really need. Even before an X-ray, I can get people started on some things, because like we talked about,
the visual indicators.
we can determine where the curve is.
Well, when it's really mild, though, can you? Still?
Usually it still shows up, and we have topography that we do, like we do with your daughter. So ideally, yes, I want an X-ray, but that's really all we need. When you go to a specialist, so you haven't been to a specialist, you haven't.
I have an appointment, but haven't been.
Yeah. So when you go to a specialist, it's usually a surgeon or a surgeon's office. So it's at primaries. There's 4 surgeons in Utah that do scoliosis surgery. There's Heflin, Smith, Belair, and Spears. And there's Klatt. So 5. You'll see them or their nurse practitioner, and they will usually do an X-ray. And in your case, it's not to the point where she needs bracing. They will look at, okay, this is what the curve is. We're not to bracing yet. Let's do another X-ray in 6 months and see if it progresses. That's pretty much what your appointment will be like. Yeah. Yours might be, hey, it's at 47 degrees, let's brace her. Or you might be meeting with the surgeon, and he'll say, well, she's a surgical candidate, let's schedule surgery. You have a choice in that. If you're like, hold up, we're not ready for surgery yet. We want to try some things. But the surgeons around here all know me, and I know them pretty well, but sometimes they're not as specific on, hey, let's proactively treat this. Like, sometimes it's still the wait and see approach, which drives me crazy. There's plenty of research to show that that is not how we should be treating this. So some of them will refer, and some of them are not as proactive as that. So just be aware that you could see anything on that spectrum.